Hello friends, let's discuss today about pancreatic cancer. If cancer has got a deadly name, then one of the reasons for that is pancreatic cancer. It has a very low incidence, thankfully, just about 0.5 to 2%, 2 per 1 lakh incidence. Unusually high in northern India, not so much in western India or southern India. But when it happens, it strikes with deadly force. What is the pancreas? The pancreas is an organ which sits behind the stomach, just on the spine. It is responsible for generating the intestinal juices which help us digest our food, and for this famous hormone insulin which controls the sugar in our body. It is connected to the small intestine, and anything that happens within this organ can affect functions which relate to digestion, which relate to the control of sugar. Hence, a very important organ. It is placed at a very critical juncture because it straddles a main important blood vessel of our body, which takes impure blood from the intestines and takes it to the liver for purification. Why am I telling you all this? Because it is related to the complexities of treatment as far as pancreatic cancer is concerned. The reasons of pancreatic cancer are not really absolutely well known, but one thing is certain: alcohol is a major cause. Alcohol and smoking are major causes of pancreatic cancer. It has also been, as I said, unusually high in northern India. Even North Indian immigrants to the UK have a high incidence of pancreatic cancer. Tropical pancreatitis, which is found in Kerala, is also known to be a risk factor as far as pancreatic cancer is concerned. How do you diagnose pancreatic cancer? Pancreatic cancer is extremely notoriously silent, and unless it advances, one hardly knows that there is pancreatic cancer inside that person. It's a small lump. Often it is found by accident, by chance. Somebody is undergoing a different surgery, like a simple surgery, like a hernia surgery. A sonography of the abdomen is done, and that picks up something in the pancreas or some such. So it's a chance diagnosis a lot of times. There is no screening test really available as far as pancreatic cancer is concerned. But if someone waits long enough, then depending on the location of the tumor in the pancreas, it can cause jaundice, it can cause pain, it can cause vomiting, and definitely as it spreads across the body, depending on the organ that it involves. For example, if it goes to the liver, it can cause decreased appetite, it can cause jaundice. If it goes to the lungs, it can cause breathlessness and cough. If it goes to any other organ, bones, etc., it will cause the symptoms related to that organ. We diagnose a pancreatic cancer by doing a CT scan or an MRI. It is a special MRI called as MRCP, that is MR cholangiopancreatography. A biopsy is seldom done if the patient requires surgery, because in pancreas, doing the biopsy can cause needle tracking. That means the needle track that happens in the biopsy can contain cancer cells. Hence, a biopsy, especially before surgery, is avoided. The other thing that in pancreatic cancer is a PET scan is done a lot of times. A PET scan is a scan of the entire body and can make out whether the cancer is limited to the pancreas or has spread across the body. The treatment of pancreatic cancer is essentially surgery or chemotherapy. Surgery for pancreatic cancer is extremely complex because we have to handle the vein that goes from the intestine to the liver. Any damage to that vein can kill a person. Nowadays, there are a lot of advances that have occurred in pancreatic surgery, including resection, including removal of the vein, joining the vein back, reconstruction of the arteries. So we are really optimistic as far as surgical advances in pancreatic cancer is concerned. We have also now done laparoscopic, and which means that instead of taking a very big incision, even we are taking a small incision and 4 or 5 small holes in the tummy, we can go ahead and do a pancreatic surgery. Besides surgery, there is radiation, which means X-ray treatment, and chemotherapy. Especially in advanced cancer of the pancreas, chemotherapy is the only treatment that can be sometimes offered to the patient. In chemotherapy, there are advances of targeted chemotherapy, which makes it easier for the patient to tolerate and also sometimes has a good response to the chemotherapy. Overall, it's an aggressive cancer, but things are changing, things are looking up, and I hope a day will come when pancreatic cancer will be as curable as breast cancer.